Hello everyone, I hope everyone is having an amazing day today. First, let me introduce myself and my group members. My name is Stacy Moses and my group member is Arisco, Eldrick, Jonathan, Joy and Kelvin. Today we are going to discuss about a topic that are really interesting, which is 4 common characteristics of government in handling COVID-19. So without further ado, let's proceed. So in this discussion, we are going to go through introduction, 4 common characteristics of government in handling COVID-19, and lastly is conclusion. As we all know, COVID-19 is an infectious disease that originally caused by the SARS-CoV-2 virus. The symptoms of COVID-19 include common cold and sore throat, and in several cases it can cause a respiratory issue. As of 22nd of November this year, there have been more than 257 million cases of COVID-19, with a total of deaths about 5 million people. This pandemic has been caused a massive loss of human life. It's incredibly difficult challenge to public health, food system, and workplace. Also, the economic and social impact is devastating. A lot of people falling into extreme poverty with an estimated amount of 619 million people. In response to this pandemic, government worldwide have implemented several measures as a counteraction, such as travel restriction, cancellation of public event and gathering, stay-at-home restriction, and lastly is vaccine mandates.
Greetings to Sir Tony and to all of our fellow coursemates. I'm Kelvin Humoc and I will be presenting on one of the common characteristics of government in handling COVID-19. That is, in terms of the implementation of travel restrictions. Travel restrictions take on various forms, differing in levels of restrictiveness. In general, they comprise the closing of borders, bans of entry or exit, suspensions of visa or transportation, mandates for quarantine on arrival, as well as border screenings. The most extreme form takes place on the international level, essentially relating to the closing of borders and bans on international travel. Although this was a common preventive measure taken by many governments worldwide, its effectiveness was actively questioned by the World Health Organization. According to the WHO, such measures come with significant economic and social impacts that must be considered carefully. Nonetheless, border closures spiked in the span of a week following the WHO's declaration of the COVID-19 outbreak as a pandemic back on the 11th of March 2020, with the highest spike falling on March 16, which saw a total of 77 countries implementing either complete or partial border closures. In the case of complete closure, access is effectively restricted to all non-citizens at international borders, whereas partial closures only involve the restriction of access at some and not all borders. Overall, a total of 189 countries, roughly accounting for 65% of the world's population, had implemented complete border closure at some point last year. On the other hand, partial closures were implemented in 193 countries. In Malaysia, the country's borders were closed on the 31st of March 2020, following a rise to the peak in COVID-19 infections among countries in Southeast Asia. Alongside the implementation of border closures, targeted bans, which involve the restriction of entry based on a person's recent travel history or nationality, were introduced in 98 countries. The first bans were initially directed towards China, but soon extended towards other countries that underwent the earliest outbreaks of the pandemic as well. Additionally, by the end of March 2020, most governments worldwide had also instituted domestic travel restrictions as well. A year later, according to the 10th and latest report on COVID-19 related travel restrictions released by the World Tourism Organization, as of June 1, 2021, most governments worldwide are still implementing some form of travel restriction. In general, 29% of global destinations remain under total closure, whereas 34% are still partially closed. Moreover, 36% require negative COVID-19 test results, usually coupled with a particular mandatory quarantine period upon arrival. All in all, only 1% of global destinations have no COVID-19 travel-related restrictions in place.
Greetings to our fellow friends and also to our lecturer. My name is Arisco Jonathan Johori with the student ID of 2020-98-1535, and I will be presenting about the government's effort to handle COVID-19 by enforcing cancellation or restrictions towards public events and gatherings. So before I'm going to show about how the government made the effort to cancel the events and gatherings in order to control the cases of COVID-19, first we have to take a look at how the massive gathering could pose threats towards the society. During the pandemic, any kinds of events that involve gathering are one of the worst things to have for a combination with the virus. Such event can let the people get easily exposed to the virus due to close contact between them. Big events such as the sports events and musical events can easily attract a lot of people, but as far as things goes, people that are infected by the virus are also present at the same time. Therefore, this can cause a major spike of cases counted in the list of COVID-infected people. So what's the worst thing about it is that the virus can spread easily with mass crowds. Thus, it manifested a cluster that spread the virus even more through people by spreading across the country. So what does the government do in this situation? Due to such circumstances, the government will take the action and control the risk of COVID-19 by prohibiting, if not restricting, the activities of large events, which include musical events and sport events, for example. And different countries have its own variation on how it is implemented. Penalties and restrictions may be different in every country. So let's have a look on several countries that I took as an example that does this effort. In Hong Kong, the government had announced that any gatherings that consist of 6 people and above are strictly prohibited, and they also add that anyone who does not comply with the rules shall pay for the fine penalty of 25,000 Hong Kong dollar. While in Singapore, it was initially announced by the Ministry of Health on 20th March 2020 that any kinds of gatherings that involve in entertainment, cultural, musical and sports events should not exceed 250 participants. But then, it was expanded on 24th March 2020 where the Ministry of Health decided to ban all kinds of gatherings events within Singapore. Meanwhile in Malaysia, the Movement Control Order, or also known as MCO, was introduced on March 18, 2020, and under that order, any kinds of events that involve physical gatherings are all prohibited, including sports events and also religious gatherings at the time. And lastly, in the United States, there were a lot of events that was cancelled due to the effect of COVID-19 toward major crowds on many gathering events. And the government at the time also decided to limit the mass gathering event and instead recommend virtual events for the future gathering that they are going to make in the future.
Before we proceed to the next topic, let me introduce myself. My name is Eldrick Kundangai, and today I will be presenting my part for today, which is movement restrictions. Movement restriction is another common characteristic of government in handling with the COVID-19 situation, since infections mostly caused by the mass movement, especially in public areas. Most governments use this method to fight the disease in the country due to its effectiveness in controlling the movement, especially in crowd areas. To verify the effectiveness of movement restriction in handling with the social movement, according to the Public Health Emergency Collection, Movement Control Order, or known as MCO, is one effective way to fight against COVID-19 infection in Malaysia. Let's proceed to the implementation of movement restriction. First of all, social gatherings are banned. Social activities are not allowed except for important reasons. For instance, in the table of restriction, of Victoria State Government in Australia, citizens are only allowed to leave their home to buy basic needs such as grocery shoppings, but with conditions. Only one representative of every household are allowed to go out, and the range of movement are only up to 5 km except for necessary reasons. Secondly, education systems temporarily changes to online distance learning, or known as ODL, to prevent mass movement through students. Learning institutions were closed, which include schools, universities, and so on. In 18 March 2020, UNESCO reported around 107 countries has closed their schools due to the pandemic. The report shows most of the government reduced the movement by using the online distance learning as the replacement for classes. Likewise, the movement restrictions follow up the closure of non-essential services, places of worships, tours, and transport. All public services that required movement are banned from operating except for a few essential services, but with conditions. For instance, the closure of places of worship, including the holy mosques in Mecca and Medina in Saudi Arabia, the closure of non-essential services in Singapore, and the recent closure of tourist activities and transportation in the area of Shanghai, China.
Hi, my name is Revathy Ronanus, and I will be continue to present about how the COVID-19 vaccine works in our body. Pathogen is a microorganism such as a bacteria, virus, parasite, or fungus that can cause illnesses in the body. Each pathogen consists of multiple subparts, each of which is very unique to that pathogen and the disease it produces. An antigen is the component of a pathogen that stimulates the production of antibody. Antibodies generated in response to pathogen antigens are an important component of the immune system in our body. Antibodies can be thought as a troops in your body's defense mechanism. Each antibodies or soldier in our system has been programmed to detect a single antigen of our body contain thousands of different antibodies. When the human body is the first exposed to an antigen, it takes time for the immune system to respond and manufacture antibodies specific to that antigen. As antigen-specific antibodies are created, they interact with the rest of the immune system to attack the pathogen and eliminate the sickness. Antibodies to one pathogen are rarely protect against the antibodies to another infection unless the two pathogens genetically such as identical relative.
Next, we are going to look at the risk and benefits of vaccine. As for the benefits, when the body is exposed to the same disease multiple times, the antibody response is considerably faster and effective than the last time. Meaning that if a person is ever exposed to the harmful infection again, their immune system will be able to respond swiftly, safeguarding them against the illness. As for the risk, some people who are fully vaccinated against COVID-19 will still get sick because no vaccine is 100% effective. Adults and children may have some side effects from the vaccine, which are normal signs that their body is building protection. This side effect may affect their stability or ability to do the daily activities. Vaccine mandates. COVID-19 was proclaimed as a pandemic by the WHO on March 11, 2020, in which the disease has resulted in more than 42 million people all over the world being tested positive for COVID-19. As in part of the breaking the chain and reducing risk of serious cases due to COVID-19, the World Health Organization along with the Ministry of Health are stepping up their efforts in encouraging their citizens in the country to be in a vaccinated phase. Therefore, there are several common methods used by the governments in handling the COVID-19 wave. Phase 1. As a step to break the COVID-19 chain and in the same time to ensure that all 80% of the population are vaccinated, The government, as in some countries, proposed an idea to give out free vaccine, which countries such as Japan, France, India, Norway, and Malaysia are available in providing the vaccine for free, as in to ensure the most of its citizens are getting required protection against the virus. Phase 2. There are also some shops or popular brands in several countries which are giving vouchers to vaccinated people through their online application. One of the example is KFC and Pizza Hut Malaysia. The franchise stated that it is one of the ways to encourage unvaccinated people to get their immunization and to thank them for contributing for a better nation in the future. Phase 3. The authorities were also pressuring those who weren't vaccinated. And one of the examples to portray the situation is Singapore. The government of Singapore have decided to opt in start charging the COVID-19 patients who were not vaccinated. This later resulted in the pressure for the people to get vaccinated. Until this day, the governments are still discussing whether the vaccination will be fully mandatory, as some people nowadays realize and questioning their rights on having the free will to get immunized. But what can I conclude for most unvaccinated people is that they will lose out many of their privileges.
Hi once again, as I have mentioned earlier, my name is Revathy Ronanus, and I will be making a conclusion about our presentation. The rise of COVID-19 pandemic has necessitated response from the government of every country around the world. In the effort of handling said pandemic, government worldwide exhibit 4 common characteristics, which are the implementation of travel restriction, cancellation of public event and gatherings, imposition of movement restriction, and the last one, the issuing of vaccine mandates. In regards to travel restriction, their usefulness is usually limited to the early passes of preventing the importation of the disease into a country's population. With that being said, more well-designed research is still required in order to evaluate its overall effectiveness. Meanwhile, the cancellation of public event and gathering is carried out by the government worldwide as a part of the social distancing measure in order to slow down the public transmission of the virus. Additionally, the wearing of face masks is usually required whenever one goes out into the public. Next, the government worldwide also enforce movement restriction. These are particularly implemented in the form of lockdown measure and stay-at-home restriction. They also encompass the closing of non-essential service to manage the flow of daily activities. Last but not least, the government around the world also enforce vaccine mandates requiring their citizens to be vaccinated in order to grant access to certain privilege. The debate regarding vaccine mandate is still ongoing, as many are still questioning its own infringement on individual free will. That's all from our group, and I would like to say thank you so much.